Hello, everyone. This is Anthony Smith, a retired special warfare boat operator, conducting interviews with retired and former SWCC operators. We're talking about SWCC, traumatic brain injury, and major orthopedic injuries. This is interview number 21. We're talking with Sean Kientz, and here is Sean Kientz.
This is Robert, Sean Kientz, retired SWCC, graduated class 13 in 94. First command was Special Boat Unit 12, follow-on orders to Naval Special Warfare Center for instructor duty, and follow-on orders from that to Special Boat Team 22, and Twilight Tour as NSO coordinator, plank owner out of NRD Nashville. Spent 15 years in the teams, deployed to numerous theaters, got my head cracked, got a skull injury in Singapore in 2000. And in addition to that, spent, I think, 8 years coastal, and 3 years in 22. In addition to that, I've been in and out of treatment for my TBI since 2000. And right now I'm dealing with another MRI coming up and CT scan for seizures that I've been having on and off throughout the years. I've had a constant headache on my left hand or my left side since 2000. And so that's about where we're at right now.
Interview number 21 is a testimonial of Sean's medical records and conditions. He answered questions from the following questionnaire formats and gave permission to produce this presentation and share it openly. We use the operator syndrome scale, the GAD-7, the PLC-5, the PHQ-9, the NSI neurobehavioral symptoms inventory, and a SWCC background questionnaire. All right, Sean served in the Navy for 20 years. He did 15 years as a SWCC operator. He graduated from SWCC class 13 back in 1994. He did 6 SWCC boat deployments, 4 of them on coastal, 2 of them on riverine at 22. He served at SBU and SBT-12. He served at the center as an instructor. He went to SBT 22, and then he did his Twilight Tour as a NSO mentor. He worked on the PB, Iranian gunboats, 11-meter ribs, Mark 5s, 24-foot ribs, and SOCAR. He has over 18,000 hours of time on SWCC fast boats and an estimated 2.2 million weight-pounding events causing whiplash and repeated mTBI. So Navy SWCC is a special class of elite naval warriors who have been a decisive force behind some of America's most important secret missions. Special boat operations have unique and often deadly challenges due to the combination of operating powerful, sophisticated machines designed for speed and stealth in some of the planet's most inhospitable environments. The average SWCC career operator experiences mTBI and major orthopedic injuries over the course of their career in peacetime and in war. And Naval Special Warfare conducts missions in over 70 countries, 365 days a year. The sum of SWCC injury does not accumulate until the operator retires. Throughout this presentation and all the presentations that I do on SWCC, traumatic brain injury, and long-term orthopedic injury, we will focus a lot on a term called operator syndrome. It's not a medical diagnosis, it's a framework that we use to describe a nexus of symptoms. It was termed and written up and published by Dr. Christopher Free. There's a DOI link there to it as well. We're talking about the nexus of operator syndrome as it pertains to special warfare boat operators. And I contacted Dr. Free, spoke with him on the phone, have gone back and forth with him on email and communicating with him to better understand operator syndrome and what it is and how it pertains to the SOF community, and continue to collaborate with Dr. Free in the future. All right, so operator syndrome is not something that we understand as a diagnosis, a medical diagnosis. What it is a qualitative descriptive framework involving a nexus of symptoms, and these symptoms are psychiatric illnesses and disorders along with chronic orthopedic injuries. Operator syndrome is an end state to a long career of high octane, high tempo, and high allostatic overload. Operator syndrome affects all SAW forces across all major branches. And when you look at the list of different SAW forces under SOCOM, you see Navy SWCC listed there. So this presentation is pertaining specifically to Navy SWCCs, or Special Warfare Boat Operators, and the end-state operator syndrome, and all this nexus of illness and injury. All right, so as I conduct my interviews, as I conducted the interview with Sean, we went over the operator syndrome scale, and this is a list here of all the different symptoms and things involving operator syndrome as a framework. And everything that you see here in red are the things that Sean is dealing with currently today. Traumatic brain injury, he's had blunt force trauma, and he's also had millions of impacts from wave pounding on SWCC boats, over 2 million impacts. Some endocrine dysfunction, sleep disturbances, obstructive sleep apnea, a lot of chronic joint pain, back pain, orthopedic problems, headaches, migraines, depression pretty severe, PTSD pretty severe, anger, some more rumination, stress reactivity, marital, family, and community dysfunction, hypervigilance, being on guard, a lot of issues with memory, concentration, and cognitive impairments, executive dysfunction, vestibular and vision impairments, some challenges with the transition from military to civilian life. And one of the things specifically with Sean is that he was basically forced to leave the SWCC community, the spec war community, due to certain events in his life. And he ended up spending the last few years on his twilight tour as an NSW, NSO mentor. So just leaving the community, leaving the brotherhood it's a challenge for all of us. Mindset that discounts the future. When you think about the nexus of injury and illness, especially pertaining to traumatic brain injury and the continual degradation over time, he has, some concerns about that. What is the future going to look like in 5 years or 10 years cognitively? That whole fear of developing invisible wounds kind of plays into this as well. So I think that's something that every SWCC operator is facing, especially the older guys, retired guys, long term, that kind of thing. Here are some of Sean's comorbidities due to SWCC boat operations. This slide looks at a lot of mental and emotional issues. He was diagnosed with traumatic brain injury at the Spec War Center. He does have a VA rating for that, which was blunt force trauma to the head during medical training. He has PTSD, severe symptoms with a VA rating, anxiety, severe symptoms with a VA rating, depression, severe symptoms with a VA rating, some endocrine dysfunction, sleep apnea, a diagnosis, no VA rating, go figure. Insomnia, difficulty staying asleep with a VA rating. He has issues with irritability, anger, aggressiveness, dizziness, vision, hearing, mood swings, personality changes, concentration issues, tinnitus, overeating, little pleasure in doing things. So a lot of things, different types of symptoms that you see with traumatic brain injury. He has severe mental fatigue, headaches, and migraines. He has headaches every day. He has a VA rating for both. Hypervigilance, short-term memory loss, pretty severe, and seizure disorder due to traumatic brain injury. Okay, on this slide, we're looking at other symptoms and issues and some orthopedic injuries. Like we've mentioned already, Sean had a head injury, traumatic brain injury, skull fracture in 2000. In his C-spine, he has a plate in his neck. His spinal cord is shaped like an hourglass. in the C region. He has L-spine issues with several bulging discs and nerve impingements. Issues with shoulders, both shoulders, surgery in his right shoulder. He has pain and arthritis in both wrists. He had surgery on his right knee, numbness in his left hand, numbness in both feet. The usual allostolic overload that we see with all guys. Chronic joint pain, high cholesterol, and due to certain circumstances, he was forced to leave the SWCC community toward the end of his career. So he ended up doing his Twilight Tour as a NSW, NSO mentor. But there's some high levels of stress with leaving the SWCC community. I think, and that's with a lot of guys that we find. Okay, so these are some of the issues and symptoms experienced due to high-speed SWCC boat operations. Sean said the following: he experienced full body slamming and whiplash from high G-force impact wave pounding on SWCC boats. He experienced blackouts due to high G-force impact wave pounding on SWCC boats. He experienced seeing stars and spots in his vision due to high G-force impacts on SWCC boats. He experienced mental fatigue due to high G-force impact wave pounding on SWCC boats. He experienced dizziness due to high G-force impact wave pounding on SWCC boats. He experienced confusion and lack of focus due to high G-force impact wave pounding on SWCC boats. He experienced blood in his urine due to high G-force impact wave pounding on SWCC boats. He experienced 4 to 10 foot seas at 50 knots during high G-force impact wave pounding on SWCC boats. 50 knots is basically 65 miles an hour. He experienced orthopedic injuries due to SWCC fast boat operations. And thinking with his current physical, emotional, and psychological conditions in mind, he did not have these physical, emotional, and psychological conditions when he graduated SWCC school and became a special warfare boat operator. He believes his conditions and issues are attributed to his SWCC fast boat operations. All right, so as we look at traumatic brain injury for SB1 SWCC retired Sean Kientz, we have to consider in the following. The average SWCC operator logs about 3,000 hours of boat time per deployment cycle. There was a 94 study done by Roche, which conducted underway studies on SWCC fast boats for 6 days, 36 hours, which totaled over 8,610 wave impacts, ranging from 2 to 25 Gs. These impacts, out of these impacts, 4,496 were 5 Gs or greater over a 36-hour time frame, which averages out about 124 significant whiplash events in an hour. The average SWCC operator probably endures about 124 whiplash events in an hour, give or take. The average SWCC operator possibly endures, though, if you look at the total impacts, over 374,000 impacts in a deployment cycle. And if you multiply that number times 6, which is the number of deployments that he did, you're looking at over 2 million significant full body impacts, wave slamming on SWCC boats, which causes disastrous long-term effects of chronic orthopedic injury, whiplash, TBI, and other issues. All right, so here's a summary of operator syndrome, all the symptoms for SB1 SWCC retired Sean Kientz. Etologically speaking, he's a 53-year-old retired SWCC operator. As of right now, this is March 2023. He has 15 years of SWCC boat service, 6 deployments as a SWCC operator, with 18,000 hours of boat time, causing over 2 million significant full body impacts while wave pounding on SWCC boats. Sean has over 18 symptoms of mTBI and a nexus of operator syndrome symptoms. He endured whiplash, blackouts, urinated blood from wave pounding at significant G-forces from full body wave pounding exposure. Sean has not been to a TBI clinic such as NICO while on active duty, but he was diagnosed with TBI on active duty at the Spec War Center, and has numerous post-concussion symptoms which impede his quality of life. Long-term effects of mTBI, major orthopedic injuries, are debilitating for SWCC operators like Sean. Sean does have a 100% disability rating from the VA, And according to Sean, when he was a young SWCC operator, first getting on SWCC boats, he did not have any significant mental, physical, or emotional impairments compared to now after many years of being on SWCC boats. And lastly, Sean does have a history of boxing in high school and in the military. All right, so concluding some different things from this ongoing TBI project, or SWCC TBI project. To date, I have 21 interviews completed, and I've also activated a SWCC TBI and orthopedic injuries survey, and there's 130 participants so far since it's been activated. So when you look at everything between the interviews and the surveys, 100% of SWCC operators interviewed or surveyed have significant TBI exposure, contributing to a nexus of post-concussion symptoms. 100% of SWCC operators interviewed or surveyed experienced full body high G-force weight pounding, contributing to whiplash, repetitive mTBI, and orthopedic injury from SWCC boat operations, which is proven to cause mental, emotional, and physical injury. And there's a reference to Galowitzer and Peterson from back in 1995. SWCC operators interviewed or surveyed so far who were never diagnosed with TBI before TBI protocols were implemented still like VA ratings for service-connected injuries due to SWCC fast boat service. And since TBI protocols were implemented in NSW or SPEC War, many modern SWCC operators to date have attended NICO and other TBI clinics while on active duty and have VA ratings for TBI and other PCS symptoms. Continuing on with the conclusions, information in this presentation provides evidence that Sean was a SWCC operator on SWCC fast boats for multiple deployments, and the aggregate of data collected in these interviews and SWCC TBI survey connect long-term TBI, post-concussion syndrome, and orthopedic injury to SWCC boat service. It's especially when I publish the information from the orthopedic and TBI survey, you're going to see just how big this thing is when we look at orthopedic injury and TBI. And the main factor here is being on boats and weight pounding at significant G forces. So it's all interconnected. These boats are causing all of these injuries and illnesses, as the data is kind of starting to show. Most importantly, thousands of former and retired SWCC operators suffer from long-term TBI, mTBI, and major orthopedic injury without acknowledgement or help from the VA or DOD. So I'm one of those guys. I fall into that category, and a lot of the other guys that I've surveyed and interviewed were on boats before TBI protocol were implemented, so they don't have proper diagnosis or treatment or any of those things. There's a gap in TBI research on the retired SWCC operators like myself, our peer group, as members of us or our group suffer from long-term issues of TBI, major orthopedic injuries. These things, you get off the boats, one decade goes by, another decade goes by, and the TBI, post-concussion symptoms, and the major orthopedic injuries, just they get worse and they get worse and they get worse, and that's what we're dealing with, is these long-term effects. References for SWCC TBI are listed in my presentation, so if you want to look at a full list of references regarding SWCC traumatic brain injury, that presentation is about 30 minutes long, and it's full of different references to show all the connections with boat service, fast boat service, weight pounding, and traumatic brain injury and orthopedic injury. A couple other references there that I mentioned in this presentation as well. So follow the links, look them up. Thank you. Have a good day.